So welcome to the next episode in the Shaking Up the Vet Industry series, where I'm empowering pet owners with the knowledge of what other services are available alongside traditional veterinary medicine. This series is not about dissing normal vet surgeries at all. This is about working alongside. So everything we're talking about is complementary. It is not alternative, if that makes sense. So today's video, you've actually got me, yours truly today, talking about the right to referral. So did you know that you have a right to refer your pet to a specialist, to a holistic vet, to a complementary vet professional in the UK? Now, I can only speak for the UK and obviously not outside of that. But did you know that you have that right to request a referral? Now, if at this point you said, no, actually, I haven't got a clue, to be honest with you, you're not going to be the first person that said that. This is why I put out a blog a few years ago now saying this, and also why I wanted to include this video in this series as well. So this is what we're going to be talking about today. Now, I worked in the veterinary referral industry for just under 8 years. I was a senior administrator, that was my main role, but I also did lots of other things, including proofreading and copy editing specialist letters, because for a few of them, their first language was not English. So we would never, ever change the clinical aspect to the letters. Anything that we weren't sure about got always checked with the veterinary specialists themselves before it was changed, but we would sometimes go in to obviously just edit how it had perhaps been written, just so that it was more free-flowing for when it went to the vet surgeries. Now, my job involved, as one of the main things, obviously answering the telephones, and we would be the first port of call for veterinary surgeries most of the time, but even sometimes pet owners as well. So we were trained so that if we took a phone call, we knew whether this was a routine appointment that we needed to schedule, whether it was what we call intermediate, so perhaps in the next few days or week, or whether it was urgent, or whether it was an emergency. And if we weren't sure, again, it was always something that we'd go and check with our managers, who were all vets and veterinary specialists, or with the vet specialists themselves that we thought it obviously related to. Now, it was the best job that I had, bar the one that I have now. I absolutely loved it. And I learned a lot. I learned a lot, actually, and it does come into play when I am with clients' pets, or even sometimes when people send inquiries to me. So just as a tiny digress for a couple of moments, I have had a couple of people literally say to me, my pet's paralyzed, could you communicate with them? You know, they're off their back legs, basically, they're not walking. To which my reply has always been, get off of this messenger or get off of this email, please phone your vet surgery. This is an emergency, potentially. This is urgent. You need to phone your vet surgery. I am not going to be doing an animal communication. They need to see a vet. So it has helped with cases like that. And I would hope, to be honest, even if I didn't have that knowledge, that it would be the thing that I would say to somebody. But it's also helped when I've been with clients' pets and perhaps I've seen the possibility of what is looking like a cloudy eye. Now, I can't diagnose, I'm not a vet, I'm not a vet nurse, I cannot diagnose, I won't diagnose, but if I see something that from my background and my knowledge suggests there is something medical or veterinary going on clinically, then I would look at that and say, right, I think you need to see your vet because cloudy eye can relate to certain conditions, so please will you go and get an appointment with your vet. So that knowledge has come in very handy to actually help my clients and signpost them. I'm not afraid to say to somebody, I'm not the person that you need to see. And quite often with cases, especially behavioural cases, the first thing I will do is say to somebody, has your pet been checked for signs of pain? Because obviously behaviour can change if they have, sudden onset of pain or symptoms along that level. So I will always ask somebody to check with their vet if I feel that it is something that could be veterinary or clinical. So I will share a couple of examples with you later on, but let's get straight into this video. As I say, this is about the right to referral. So at the time of me recording this in the UK, you have to have you have the right to have a referral, a veterinary referral, and normally the way it works is the referral would come from your first opinion vet surgery. So they would basically contact the referral centre on your behalf. Now, the reason that this needs to be done, the reason that it has to involve your vets, I'm going to say vets and referral vets, just so that vets is first opinion, you know, the vet you normally use for your pet's care, and referral vet is obviously the specialist that we'll be talking about in this video. So the reason that they do this is, as hopefully you can understand, the referral centre is going to want your pet's veterinary records. That includes their history, that includes any tests that have been done and the results of those tests, any x-rays, any CT scans, MRI scans, ultrasounds, abdominal scans, etc., etc. So any treatment that your pet has had, any treatment or further workup that's already been done, the referral centre is going to want to see that. Now, that's partly obviously because they want to have the full picture of what's already been assessed, but also it can sometimes save you money. So if they don't need to do x-rays again because the ones that your normal vets did were fine, then they won't do it. If they did need to do it, then of course they're going to ask if they can. So it can save you money if, of course, as I say, that all of the history goes over and all of the test results, all of the scans and so on. And it's also continuity of care as well, because you know, when you get referred to a veterinary specialist, they are going to again keep your normal vets up to date. They're going to be sending letters. Potentially they might be contacting them by phone if they needed to, or by email to talk to them. So it's for continuity of care, so that actually when you've seen that specialist and perhaps your treatment is complete with them, your vet surgery knows exactly what's been done, exactly what, for instance, medication your pet might be on, or what surgery they may have had. They might then have questions that they come back to the specialist to ask about, or you might have a question that they can then have a look at the details. They might be able to answer that, or they may go back to the specialist and ask. So it is for continuity of your pet's care that obviously we want to keep your normal vets involved, the first opinion vets involved. And of course, it's courtesy as well. If you have a good relationship with your vet, then it's courtesy to say to them, I would like to have my pet referred. And something that you'll hear me say probably throughout this video is you can ask them, you know, do they have a veterinary referral centre that they use for your pet's condition? If not, do they have a recommendation? Or the other thing that you can do, if you so wished, is you can Google. So you can Google either veterinary hospital to see if they have specialists, because a lot of veterinary hospitals have specialists, or veterinary referral centre, you know, near Kent, near Scotland, whoever. Or it might be a case of you type in a veterinary specialist, but sometimes you probably need to know what specialist you're looking at. Okay, so I've written everything down here, so hopefully we're covering all bases. But the thing is that, as I say, you know, they don't have to be, your first opinion vet doesn't have to be the one to make the decision for the referral. Okay, as an owner, you have a right to request a referral, and I have done it on several occasions. I don't regret doing it. Obviously, it's slightly different because I've worked in the background in the industry, so I understand, you know, how specialists can help and so on. But what I'm saying is that, you know, if you want to refer your pet onwards to a specialist, that you feel that's the right time, do please, in order to try and keep the relationship with your vet, talk to them about it first and foremost, okay, and seek whatever help you can from them with regards to that. Or, as I say, you can self-refer, and sometimes it ends up being that way. So with Puss, for instance, she was referred to Chirovet, and that's one of the videos that obviously I share in this series. She was referred to them kind of through the charity, through me, and then sort of through the vet. So we sort of did it slightly differently. So sometimes that does happen, but ultimately the referring vet that you go to, so the referral centre or that referral specialist, will want the history and the scans and the tests and so on that your pet has had. They're going to want to know what's going on, what's already been done, you know, what's been ruled out and so on, in order for them to obviously work with your pet. So hopefully, as I say, you'll be in a position where you have a good relationship with your vet, and therefore you can talk things through with them. You can perhaps decide together. They can talk to you about a referral centre that they may use when they need to. Or it may be that they just are very willing to trust and honour your decision that you would like to go for a veterinary referral. However, and this is the reason that I'm recording this video. So when I was working in the veterinary referral industry, we did have quite a few times where people would ring and say that they hadn't been given that option by their vet. It hadn't been mentioned. Even outside of working in the veterinary referral industry, I've had people around me say that. I've experienced it, not personally, if that makes sense, but the people around me. And I've had to say to them, do you understand that you have a right to request a veterinary referral? So this is the reason I'm recording this video, because quite honestly, how can anyone refer their pet to a specialist if they don't even realise that's a possibility, that it's an option? It won't necessarily be the first option. You may be working with your first opinion vet for a little while before the decision is made for both of you or one of you that actually we want to have a veterinary specialist, you know, work with our pet. Okay, but sometimes, sadly, people have not been given that option, and this is the main reason that I'm recording this episode. So as I say, sometimes pet owners just don't know that it's available, so they can't ask for it. It's often the case where people, pet owners are feeling powerless and helpless to help their pet. It might be that their first opinion vet has run through a lot of things and is really stumped and they don't know what to do. So that could be another reason why you might suggest it and just say, well, how about we refer them to an appropriate veterinary specialist? So that might be another option. Or it might be that you are just getting so frustrated at seeing your baby, and I will say baby because most of us call them our babies, seeing your baby so unwell or suffering, or, you know, we're not getting to the bottom of this and they've had test after test, and therefore you kind of go, right, I'm calling there, I'd like to go and see a veterinary specialist. Okay, so you have that right. As I say, all along, you know, trying out courtesy to your vet and also keeping a good relationship with your vet, try and discuss it with them first and foremost. And with a lot of the specialists that I've interviewed in their fields, you know, they have literally turned around and said, yes, we need a veterinary referral, but there's no reason why your vet's going to refuse that referral. Okay, but if you do ever come across that, then if you do self-refer to that veterinary referral centre, tell them, just say to them, you know, my vet is not wanting to do it. They don't want to do it. It doesn't mean that it can't go ahead, but you're also kind of just letting them know that that's obviously what you've been told. Now, with regards to the money aspect of this, absolutely, yes, the veterinary referral industry will be more expensive because you are seeing a specialist, okay? Because quite often, like we had in that veterinary referral industry in our company, we had nurses that were specialised to work with certain disciplines, for instance, to work in the situation of veterinary referrals. The equipment, so at one point I was actually working on the accounts aspect of veterinary referrals, and believe you me when I say equipment for veterinary specialisms is not cheap. It is definitely not cheap. So if you think that actually the costs may be high and you're not sure why, believe you me, when you see that one piece of equipment costs 21,000 euros, and that's just one piece of equipment for a specialist to be able to use in theatre, for instance, with your pet in surgery, to ensure that obviously it's, the surgery is effective and is using the equipment that's needed, then you imagine what other bits and bobs are involved, that actually the costs then add up as well. Like I said to somebody, that, you know, actually sending your pet to a veterinary specialist is a bit like referring yourself to Bupa, or being seen via Bupa. It's private treatment, really, you know, is how I kind of see it for pets. So just bear that in mind. Yes, the costs are going to be higher, but I did want to just briefly come on to that. So a lot of veterinary referral centres will offer things like payment plans. Some will offer 0% finance. That's definitely something that we used to do. Or they might even be able to do a direct insurance claim if you are insured. Obviously, if it was a direct insurance claim, you would have to pay the excesses. So they probably will want to see a copy of your policy and all of the finer details. You would have to pay any exclusions, and you would still be responsible if, of course, the insurance company didn't pay. But what you might be able to do, and again, you'd need to check this with your own, you know, with that veterinary referral centre, for instance, or even with your own vets if it was needed at the time, is you may be able to phone your insurer and ask about whether you're insured for that particular condition or treatment, and up to what limit, because some policies obviously have a limit. Some of them are for life, some of them will insure you for that condition for up to a year, up to a particular monetary limit. So it's worth just checking in your insurance, obviously, you know, whether you're covered, and if so, how much, and so on, and for how long. So that way, and it might be, as I say, that the veterinary referral centre, you know, the administration team might be able to have a look at your policy and have a look through with you to see if they can spot any cover limits and exclusions. But of course, as I say, they are not responsible. Ultimately, you are. Okay, but I'm sure they will do the best, like we did, to try and help people discover. So if you are looking at insurance, it is worth looking at whether you're covered for life, whether you're covered for a particular whether you're covered for conditions up to a certain limit, or it's ongoing, and so on. So do look at the policies before you take them out. The most common veterinary referrals that we used to see in our centre was surgery. So that was soft tissue surgery and orthopedic surgery. We used to see ophthalmology. I do love that word, ophthalmology cases. So that might be pets that have corneal ulcers, or they needed, sadly, to have an enucleation, which is the removal of an eye, or it might be they have cataracts that need, you know, attending to. Lots of different things. So all of these cases had obviously multiple conditions that they would, all these disciplines, sorry, had multiple cases and conditions they would work with. Internal medicine, so sometimes, very occasionally, that would overlap with certain types of sort of surgery cases, sometimes even, you know, neurology. So sometimes the disciplines do overlap, which is also why obviously referral centres quite often want to see the history, because then they decide based on that history and the tests and everything that's been done who might be better to be seen first, because it might be a case of you need to maybe see two disciplines. So that can sometimes happen in the trickier cases. So neurology obviously would be another referral. Dermatology, so skin issues. So that could be things like if your pet has been in contact with foxes and they've got sarcoptic mange, or it could be that they've got allergies. It could be that they just have dry skin and it's just not clearing up, who knows, but there'd be various different things. Dermatology, ENT, so ear, nose and throat, so that would be another one. It's quite obvious. Cardiology, so pets, for instance, with heart issues, heart murmurs, all of those kind of things, and ultrasound. So sometimes that can be a referral in itself for a pet to have an ultrasound. So some places do provide the possibility of having that, like an external referral to an ultrasonographer. And I will say, actually, working in veterinary referrals has been amazing, because there's been several instances where, to be honest with you, I've actually got help from a veterinary specialist, both far quicker and far more detailed than my own GP doctor. But as I say, obviously, it wasn't on a more clinical level. So for instance, when I had shingles, our very kind ophthalmologist actually gave me a personal call and recommended a particular eye drop, which would be better for long-term use and so on. And also at one point when I actually started out at the veterinary referral surgery doing cleaning, I actually found out I was allergic to latex gloves, and that was through one of our dermatologists. So it all gets very interesting. Obviously, they didn't do any clinical work or anything. All of that had to be done through my GP surgery, but they were certainly able to have a look and say, I kind of suspect this might be the case, but you'll need to go to your GP and get them to do skin scrapings and so on. Okay, so other referrals that might happen, it could be that your pet, you want your pet to see a chiropractor. It could be they see an osteopath, a veterinary acupuncturist, a veterinary physiotherapist, a holistic vet, and that holistic vet could deal in all manner of things. So I know a few holistic vets that deal with, you know, sort of acupuncture and other things, traditional Chinese medicine, and so on. So they could have a mixed bag of toolkit. Also homeopath, that might be another one that you may consider as well. There might be others, so the list is not extensive, but that probably keeps going for a while. So the next thing I'm going to talk to you about is how. So how do we do this, you know? So as I've said earlier, the first thing would be to speak to your vet first and foremost. It might be a case that actually your vet surgery already has vets who have had specialist training. That does happen. So it might be that they have a certificate in small animal surgery, for instance. It might be that they have a certificate in small animal medicine. It could be that they have a diploma in something or other. So it's again, it might be that they just refer internally if the discipline that your pet needs, they already have somebody, a vet that covers that. However, otherwise it's worth asking, do they have a veterinary referral centre that they would recommend? Other than that, as I say, you can Google veterinary referral centre near to and put your location, or veterinary specialist near to, or veterinary hospital near to, and then have a look at their website and see if they offer the services. Okay, so just to give you an idea of some, so in the Kent and Surrey area, quite well known, you've got Fitzpatrick Referrals with Noel Fitzpatrick, who's been featured on TV plenty of times and has written plenty of books, so many of you will probably recognise that name. You've got VNR, you've got Barton Veterinary Hospital, they're based in Canterbury. You've also got Stone Lion Vet Hospital, who are in Wimbledon. You've got in Norfolk, you've got Dick White Referrals. You've got VRCC, who are based around kind of Laindon or Southendy type way in Essex, really Laindon, I think, in Essex, so just over the Dartford crossing. You've got the RVC, Royal Veterinary College, Queen Mother Hospital, and Davies Veterinary Specialist. They're kind of around Hatfield Way. So there's lots of different ones. Obviously, what I've just shared with you is not going to be the end point with veterinary referral centres. There's going to be plenty in different places that I haven't mentioned. So Google that. So in terms of it actually happening, so method one, if you will, is if you did it through your vet. So what they would be doing is they will, once they've got your permission to refer your pet, they will contact the veterinary referral centre. Okay, they will probably get the vets to fill in a form and send over the medical history. And then what would happen is that veterinary referral centre would contact you directly as the pet owner, as the client, explain to you obviously everything that you would need to know with regards to the appointment as best one can, and then book you in. And once you're then booked in for a date and a time, then they would phone your referring vets, as we would call them, and update them and just say, oh, you know, Mrs. Wong has booked her appointment with, Pierre to have a first consultation on, Monday the 6th of November at, 12 o'clock or whatever it might be. Okay, so then your vet surgery is kept up to date as well. Your vets may also give you documentation or things to take with you. So they might, if they've done physical x-rays, if they're not digital, they may ask you to take them with you. They might have the x-rays on CD, or they might have the big x-rays that you get. So they might ask you to take that. They might give you another copy of the history and, you know, test results that have been done and scans and so on. So it may be worth asking your vets, so your first opinion vets, if they did refer, it might be worth asking them sort of a couple of days before your appointment, is there anything I need to pick up? Has all the surgery and test results and x-rays and everything gone across? Or do I need to take those with me? If so, can I come and get them? So that you're not kind of rushing around last minute, or you're in a consultation and somebody's saying, oh, I haven't seen the x-rays, and you're like, oh, I didn't realise I needed to bring them. So just be worth kind of forewarned is forearmed. Okay. The other way, of course, as I say, is self-referral as such. So you can contact some veterinary referral specialists, and they may well accept the referral through you and get you to fill in a form, but they will still want your first opinion vets, all of their history, your pet's veterinary records, basically, including anything and everything. So they're still going to want that, but they may allow you to actually fill in all of your details on a form, because you are the pet owner, and then just basically say, you know, do I have permission to ring your vets and get the history? And you say yes. Your own vets may ring you to say, we've had a call from so-and-so veterinary specialist, so they would like to have, you know, Fluffy's medical records or veterinary records sent across. Do you give us permission to do this? Because GDPR wise, obviously they have to do it. Now, again, if you want to be super prepared, what you could do is, if you're doing it that way and needing to do it that way, then you could actually send an email to your veterinary surgery, or phone them and say, I've just asked my pet to be referred to this person, and they are going to therefore request the history and whatever else is involved. So I'd like you to know that I give permission. Normally or quite often they will need that in writing. So it might be better just send them send them a quick email. But some will take it over the phone. Certainly when I've had it and the vets have actually phoned me and said, do you give us permission to send this across? And I've said yes. So some will be verbal, some will be written. Again, you could check that. And just ask so that everything is sorted. If, like I said, your vet is not willing to do that referral, to actually speak to them, I would definitely ask why. Is there a particular reason that they're advising you that they're refusing to do it? As I say, all the specialists that I've interviewed have never had that. I think we heard about it once when we were working in the vet surgeries. So it shows that it does happen, but it's not going to happen often, because at the end of the day, you know, your vet is obviously wanting to look after your pet's care. But I would definitely tell the referral centre if that was the case. It doesn't mean that they're not going to not update them, because that would need to happen for your pet's care and their continuity of care. But it would still probably be worth just saying to them, sadly, my vet has refused to do this, so I'm self-referring, and see what they say. It doesn't mean that your vet won't cooperate with them. It just means that for whatever reason they're refusing to do the referral. And as I say, you would need to ask them if that was the case. So moving on, the day of the appointment itself. So I wanted to just try and give you as much as a heads up as I could, because again, sometimes it's nice to know this. Obviously, please bear in mind, you know, disclaimer, some veterinary referral centres might work slightly differently to this, but hopefully it gives you a bit of a ballpark idea of what might occur. So when you're booking the appointment, the veterinary referral team may ask you to withhold food from your pet for 6 hours or more prior to the appointment. Now, we used to say 6 hours. I've been told sometimes don't give, you know, any food after 10 o'clock at night. Sometimes it's been, you know, a specific, you know, 12-hour time period. So again, just bear in mind that they might want you to withhold food. They normally will allow your pet to have water down, but please don't think that liquid milk equals liquid. Normally and that's certainly when we were working with vet referrals, it was seen that milk is still food. So if you're thinking of giving your pet milk or something other than water as a drink, check with your vet surgery, please, or with the veterinary referral centre, to make sure that, you know, if you're putting something down, that it's going to be appropriate. And I won't even get started on milk not being good for pets, but so the reason that they do this is not obviously to make your pet feel bad. It's basically that they do this so that if they need to go ahead, if you consent to going ahead with further treatment or with any surgery or any further treatment, basically whatever would be appropriate for your pet, that they don't have food in their system. And I will say to you now, even with Puss, she was 9 hours post having eaten a small amount of food before she had x-rays in her last few days, and she still brought some food up when she had x-rays. So it shows you how long it can stay in their system. So, you know, the vets aren't doing this in any manner or form, you know, to make your pet suffer. Please do not think that. They are doing it for a clinical reason, to ensure your pet's safety. Okay. There may be forms, and very likely will be forms to fill in when you arrive. Quite often that will be, you know, consent forms that you understand that the appointment is going to cost this much and that you're seeing this person. Obviously, if you decide to go ahead with further treatment, then there will most likely be, there may be further forms you need to sign. But what I know, when we used to do it, we used to basically include the possibility of further treatment in our estimates, because that would always be quite often worked out before somebody came. So there will very likely be forms to fill in, and once you've done that, then obviously you would see the specialist. From there, the further treatment that is needed depends on the reason that your pet is actually going to see them. Your pet may or may not stay in. It just depends, obviously, again, on what treatment is required. It might just be a case of you needing to wait around for a while they have certain tests done. That sometimes does happen, and sometimes even people choose to stay the whole day. We literally had people that would stay the whole day, bless them, and stay in the vet surgery. And actually sometimes, you know, if one of our staff members was popping out to the local supermarket to get a sandwich, you know, we would be nice enough to actually say, so do you want us to get you anything, because we're going? So let us know, because we were kind of in the middle of nowhere. There wasn't any local shops that they could walk to or anything. And I do think, to be honest, we were quite unique in doing things like that, actually, as a veterinary referral centre. We were a very good team, and we had very good work ethics and client ethics, very much so. So your first opinion vets, as I say, should get updates from the referral vet, and they would let them know obviously what has been done to ensure that there's no contraindications. They would obviously need to know what medications your pet or pets were on, and as I say, for the continuity of care. So when the treatment plan was complete with the referral vet, or you decided to stop seeing the referral vet, so you decided not to go ahead with further treatment for whatever reason, that could be cost, it could be that you need to just have a think about it, then of course, as I say, they would let your vet surgery know. Okay, your first opinion vets would stay as that. They would still be your first opinion vets. The veterinary referral team are literally there for that referral, and of course any follow-ups that would be required. So coming on now just to a few reasons why I'm sharing this. So one already you know about, which is basically that I got sick of hearing people say that they didn't have a clue that veterinary specialists existed, that it was even possible. And I wanted to empower people with that knowledge, so that if they were in a position where they felt like, you know, they wanted to elevate the treatment for their pet, in terms of, you know, maybe they weren't getting anywhere, or there was just no signs of improvement or whatever, and they tried everything and their vet's baffled, that they can say to them, how about a veterinary specialist? You know, like, they put the option out there and they put it on the table. So that was one reason, obviously, people not knowing. The other reason is basically somebody around me had a dog who had a paralysed larynx and was being seen by their first opinion vets. At no point did they suggest veterinary referral to a specialist at all. So they just said to this person that it was all about just managing the condition, that nothing could be done. And when this person spoke to me, I asked a little bit more about the condition, and they were talking about obviously what it involved. And I was like, well, that's muscular by the sounds of it. You know, I'm wondering whether veterinary acupuncture might be able to help because of obviously the effect it can have on muscles. So I ended up contacting some veterinary acupuncturists who said that yes, quite often veterinary acupuncture can, in most cases, help paralyzed larynxes. And this person did actually decide to go ahead with referral. And sadly, before that actually was able to go ahead, their pet deteriorated and actually had to be put to sleep because it was the deterioration was so severe that it would not have been fair to obviously keep the pet alive. And that made me both very sad, quite frustrated, and also just a tad angry that had veterinary referral been mentioned, even if that person couldn't recommend, but just said you might consider, because I appreciate that if you're recommending somebody, then obviously your reputation is at large. I get that. But because it wasn't recommended, of course, by the time I got to be able to speak to that person, time had gone on. And it's one of those things where you do wonder, could it have been a different outcome had that referral been able to go ahead? So that's number one. Number two is actually beautiful puss, my baby that's now in spirit. So during her life, she was referred to an osteopath, to a chiropractor, to the same chiropractor that also deals with traditional Chinese medicine, to a veterinary acupuncturist. So she had acupuncture as well. And partly that was because when I was trying to help, when I knew that she had a problem with her back, because every time I used to brush her, her fur used to ruffle. And I could feel into it that there was some sensitivity there. And sometimes she would arch her back like away from the brush. So I knew there was something she wasn't quite liking. And something said to me, okay, so if I had a bad back, who would I go and see? Now, I wouldn't generally go to see my doctor unless I felt it was appropriate. I'd go to see an osteopath or a chiropractor. And that's what started it, basically, is me getting in touch with a veterinary osteopath, and then obviously speaking to the charity that were her guardian. And, they okayed it, and she saw an osteopath. And as I say, she did have veterinary acupuncture as well to help manage, and that was definitely helping. I definitely saw her sensitivity in the spine actually reducing, and her feeling a lot better within herself. You could see it in her flexibility and her movement. And then, as I say, she also saw one of the specialists that I've interviewed, Julia, who is chirovet, and she did actually basically did do veterinary acupuncture with her. But of course, with her extra knowledge, she also did have some TCM, traditional Chinese medicine. So she had herbs to come home with, to work with, to also help on a holistic level with the conditions that are going on. So in that case, I referred her to chirovet, and once I got the okay, obviously from the charity, they were happy for her to be seen. They'd actually used her before, so they were fine with that. And as I say, that worked out, that we'd got that consent and I was allowed to do it. Also, my previous cat, Phoebe, so when she, bless her, was we didn't know at the time, but when she was nearing the end of her life, so she started wetting the bed. And okay, you could say, well, this is an elderly cat, she was going on 16, so she started to wet the bed. It's something she'd never ever done before. But the reason that things started, like I started thinking differently, was because she would, from that would wake her up, and she would look at me so confused and so distraught because she knew she'd done for something that she shouldn't have. And it pained me so much to see her suffering, on the expression on her face of she didn't understand what had gone on. She didn't understand why she was wet. She didn't understand, you know, why this was happening. And you could just see like the shame and the guilt of, I know I've done something wrong, you know, with her head down. And I couldn't bear, obviously, that. So when it happened, like the first time, you just think it's a one-off because she's done it before when she got really excited and was running around and stuff like that. So when it happened a second time within a very short space of time, of course, off we went to the vet straight away. Now, the vet that I saw actually turned around to me and said she's just dehydrated. Now, Phoebe used to suffer with UTIs, urinary tract infections, and there were certain signs that I would see when she had those. Now, she also started to exhibit those signs after the first accident she had. And so when I took her to the vets and they said she's just dehydrated, I'd already said to them, I think she's got urinary tract infection. I thought it was just that. And they said, no, she's just dehydrated. And it's the first and ever time I've actually turned around to a vet and said, I completely disagree with you. I think you're wrong. And it just came straight out. Like, I was as shocked as probably the vet was, to be fair. But I also stood by it because it was like, you know, as a pet owner, again, you know, sometimes you will just know and you're like, no, you know, I knew she wasn't dehydrated. And I nearly came out of that consult believing that person, like, oh, I must just be wrong, you know, and not trusting myself. And then conversations happened with somebody around me that is clinical, and they said, I think you need to speak to so and so. You know, they were a feline internal medicine specialist, somebody that I knew well, trusted very well, had worked with Phoebe before, so she knew her. And I spoke to her, and luckily she worked within the same clinic, veterinary clinic, and she had a look at her urine results, and I think also bloods were done possibly. And basically she said, came back to me and said, I'm really sorry to tell you, but she's in the first stages of kidney failure. And she said, from what you're describing, I think she's also got cognitive deficit, which elderly pets tend to get, where they get that kind of confused sort of dementia type state. And I had a chat with her, and she said she does have a urinary tract infection. You are correct. So she said, what we can do is we can give her antibiotics for that. But she said, obviously, I have to be honest with you. This isn't going to get better. This is going to get worse. So I made the decision, and again, I don't regret doing it. I made the decision that, yes, we were going to have the medications for the urinary tract infection. And I did say to her, am I making her suffer if I keep her with me for another week so that I can say everything that I want to say to her, be with her, spend quality time with her, and then make the decision? Because obviously we were at the point now where, as I say, she was, you know, she was wet in the bed quite frequently, and this couldn't continue because it was upsetting to her. Out of anything, I could see the distress. And as I've always said, for me, it's a quality of life. And if they do not have quality of life, it doesn't matter how distraught I am, how much I'm going to miss them. You know, even if my life is in turmoil, I will not keep them going for me. It is not fair. And I've stood by that, and I stand by that, and I stood by it with Phoebes, I stood by it with Puss. You know, they come first. So I was told, no, she won't be suffering. She's on her medication. So actually the urinary tract infection will be getting better. You know, she's not in any pain from the kidney failure. It's just obviously if she wets the bed again. Now she didn't, so that was good. And it may well be that the urinary tract infection was part of obviously the reason she might have been doing that as well. Obviously I can't say that for certain, I'm not a vet, but it could play part in it that she just couldn't hold it in. So that's what I did. You know, I spent that time with her. I told her everything that I wanted to tell her and needed to tell her, so that when that time came, I knew that I'd said everything that I needed to tell, you know, to say. And we did it at home, not me. I had that same veterinary specialist come out with a nurse. We paid for them to come to my home, and we effectively had her put to sleep at home because she got very stressed going into vet surgeries. So my main reason was because I don't want to put her in that position. I want her to be put to sleep where it's familiar smells, familiar territory. She's surrounded by everything that she knows. And also because obviously I was quite concerned that actually after that process, that procedure, would I actually be capable enough of actually driving home, because she was my first cat. So, you know, I was pretty distraught, shall we say, to have her put to sleep. So, and don't get me wrong, I would have got somebody to take me if needed, but I knew that she got very stressed at veterinary surgery. So why am I going to do that? So, you know, the procedure was actually done at home. Okay, so although there wasn't a great outcome, you know, I get that. At the same stage, obviously, if I hadn't spoken to that veterinary specialist and they'd had a look at those test results and said, again, we would have acted differently. We would have continued and so on. And also, she had a urinary tract infection, so that would have continued to have not been treated, and that did not make me happy. I was not a happy bunny. So I do not regret actually seeking that help. The first opinion vet that I originally saw, let's just say, was not happy about me doing that. I did kind of get shunned a little bit with regards to that. But to be quite honest with you, I don't care. You know, I disagreed with them, and I was right to disagree with them, because the veterinary specialist shared that, yes, I thought she'd got a UTI, and I was right. She did have a UTI. She was exhibiting the same symptoms. And actually, I said, I feel like there's something else, but I just don't know, because she's never done this before when she's had a UTI. So I knew something wasn't quite right. Did I expect what they actually diagnosed? No, I didn't. You know, but sadly, we can't predict that. So I don't regret it. And to be quite honest, if that vet talked to me about it, I would tell them why I did it. So that is just, you know, that is just me. I will keep the relationship with my vet as best I can. But with this particular vet clinic, we used to see different vets and things anyway. So it doesn't bother me if they chose to take offence, you know, by the fact that I got somebody else to look at the urine and blood results and they diagnosed. That's not really my issue, it's theirs, I'm afraid to say. However, okay, there's just a few examples why I wanted to share this video, because it's important. It's important for pet owners to have this knowledge, to know that you have a right to request a veterinary referral or referral to a veterinary professional that can work alongside traditional veterinary medicine, that is complementary. Okay, so if you want to see a veterinary specialist, or as I say, another service that's alongside your first opinion vet, please, as I say, speak to your vet first and foremost. Try and keep that good relationship with them. You know, ask for their advice. Can they recommend a referral centre? Is there one that they use? Excuse me. Do they have somebody internal that they can refer your pet to who has specialist training? It does happen. Okay. As I say, some vets will actually have after their name the qualification letters, so Cert SAM, Certificate of Small Animal Medicine, Cert SAS, Certificate in Small Animal Surgery, DIP ECVS, which I believe is diploma from the European College of Vet Surgeons or Surgery. So they might have obviously the specialist training in the discipline. So do speak to your vets. But as I say, remember, if it's not mentioned and you would like, you know, you would like your pet to see a specialist, then, you know, put that option on the table and just say, I would like my baby to see a veterinary specialist. I would like to kind of escalate their care to a specialist. Okay. Even with Puss, when we were having to make a decision between life and death, because I couldn't get the answers that I was needing to give the go ahead, I asked for her x-rays to be reviewed by an orthopedic specialist. And very kindly, the charity did say yes. they were willing to do that. It was actually through the specialist reviewing those x-rays and advising us of something that they saw in the x-ray that hadn't been pointed out at any point with any vet surgery that I'd been with, not just obviously her last surgery. It made the decision that we had to make. It wasn't one I wanted to make, but it was one that we had to make. So as you can see, sometimes it can be, you know, life or death in that situation. So I think I've warbled on enough. I hope you have found this information useful to kind of keep in your memory bank, so that if for any reason that you do need that for your pet, that you have it there. Okay. I want to help pet owners. I want to empower you with as much knowledge as possible, so that you have some options, you have some, you know, have some ideas, because I know that you, like me, you know, want the best for your pet. You want the best care for them. Okay, and it doesn't mean that your first opinion vets are not the best care for them, but it's a bit like if I see my GP, they are a general vet. Sorry, they're not a general vet. They're a general practitioner, you know, doctor. They are not a consultant. They are not a specialist. You get referred. It's quite normal, isn't it? You go to see your doctor for X. They refer you to a specialist or a consultant for X. So, you know, it's quite common, obviously, in our NHS system and you know, private. So why would it be any different in the veterinary industry? You see a GP vet, they may get to a point where you need to see a specialist. So I'm really hoping that that has helped you. It's been a very long video, so I apologise for that, but I just wanted to make sure that I gave you as much as I possibly could regarding that. As I say, just remember that some, you know, veterinary referral centres might work teensy bit differently to what I've said. I'm working based on my knowledge of what you know, the industry I was in for just under 8 years, and sharing all of that with you, but it will give you hopefully a ballpark to work with. So thank you for listening. Thank you for watching. Take care. This is me, Victoria, people and pet therapist, medium and healer, signing off. Bye for now.